Boy, I've been to some school districts with 900 students that haven't had a turnout like this before, so I'm really impressed that people have come out to talk about this subject. We've done presentations, we've done needs assessments in every school district in Geauga County over the last 25 years and tracked how kids and adults both have used and abused chemicals throughout the community. And I think this shows a response to an addiction that has really penetrated this community in a way that we've never seen before. I'm not going to, you just cut my presentation by like 30 minutes. I only have an hour worth left. So, Dennis and the judge and several of you in this room have worked well together for many years on this subject, and it's we've seen it grow in its intensity just over time. I just had a couple of comments that I'd like to make, and ditto for all these great things. Nikki, thanks for your story. I appreciate that very much. As a family member who lost someone to an addiction, my cousin, when he was 22 years old, jumped out of a convertible on a freeway while he was under the influence. And so I know the pain that causes families for generations. It's not just a year, it's not just 2 years, it's generations that touches. So I appreciate your sharing that story. Just a couple of comments. Number one is, for those of you that don't know, the Board of Mental Health and Recovery Services is in fact designated by the Ohio Revised Code as the authority for drug and alcohol and mental health services for public funded services for the region. And in this case, our region is Geauga County. We fund 9 public service agencies. That includes things like Lake Geauga Center, Rainwood Mental Health Center, Women's Safe, the Domestic Violence Shelter, Big Brothers Big Sisters, the DARE program with the Sheriff's Department, among many others. So we have a long history. We were established in 1967, and some days I feel like I've been there since 1967. But I've been there for 25 years now, and so we have a long history of identifying individuals with these issues, providing prevention and providing treatment for these individuals. This year alone, the board will provide treatment through its agencies to over 12,000 Geauga County residents, including about 2,300 in addiction services alone. So we know that this is a major problem that has come up. A couple suggestions I'd like to make in referring to your proposals and to this community. Number one is that whatever you decide to do, be it now or in the future, my board strongly recommends that it be evidence-based. There is national information about what we should be doing and how we should be doing it, and every decision we make on our funding end on whether services should be provided in treatment or prevention, they must be evidence-based and have a long history of positive outcomes. Unfortunately, I would say that in reviewing some of the proposals you've seen, they don't meet that national standard. I think this community deserves only the very best, and so I would certainly encourage you to make sure that that happens. Along that line, I would suggest that perhaps one way to do that would be to funnel those treatment dollars through the board. I don't want any money, and the reality is I don't want any more work, right, Linda? The chairman of my board is here, as well as some past members, but the board does provide several things in that regard. Number one, we have contracts with agencies that provide liability, that provide oversight, that provide evaluation. We do that every year for every program. We provide 115,000, we process 115,000 claims a year for services in this community with just 5 staff. And we'll continue to do that. We'll pass 100% of the dollars through, but we'll give you the ability to have a contractual relationship with anybody that you provide, that we provide prevention and treatment programs with. Those prevention and treatment programs should meet national standards. I've got a list of those. I'll provide those to you that we think are absolutely essential in creating good treatment programs. I think the judge did a great job talking about residential treatment. It is the #1 treatment program in identifying long-term care and long-term positive outcomes for this addiction. The other thing I would say is that prevention services start early. They should start in the elementary schools. They should start with parenting programs, and we've already done some of those. But unfortunately, as you guys know, we were cut 40% of our funding over the last 3 years, and so many of those programs have been cut substantially or eliminated. Ironically, Big Brothers Big Sisters that does the after-school program and mentoring program was identified as one of the #1 prevention programs in the nation. And we have that program in Geauga County. I think that's worth celebrating. Some of the other things that we do that were identified by the SAMHSA, the Substance Abuse and Mental Health Services Administration, they're nationally recognized evidence-based programs we have right here. Motivational interviewing is done by Raywood Mental Health Center. All-Stars program was started by Family First Council, which the judge talked about earlier, as well as the postcard campaign. Big Brothers Big Sisters mentoring program. Mental health first aid. The board has now had 2 people on our staff certified in national mental health first aid. We are the first 2 people in the state that were certified in youth mental health first aid right here in Geauga County. That is a nationally recognized program. And finally, Incredible Years, which has been in several of our schools, is operated through Catholic Charity Services in several of our schools and preschools in cooperation with the Department of Job and Family Services. So we have several things that are already in place, several things that have been reduced or eliminated that would be thoughtfully brought back, and I think would add to the issue of creating an environment where prevention is the initial answer to addiction services in this community. We have done this in many schools. The other thing I would note is that in several proposals and in talking with several people, I just want to mention there is no silver bullet to this program. There is no silver bullet to this cure, to this disease. The reality is this is a long-term problem. Every national healthcare institution has recognized that. That's why the long-term residential treatment has been identified as the #1 treatment program for this disease. And so anyone that comes and says, I can fix this with just this one thing, I would hesitate to say that I don't believe that's going to happen, and prevention and treatment together will make up for a long-term cure. We've had a lot of success, and I really appreciate the people that have been a part of this process, whether it's JFS or whether it's the judges, whether it's the Sheriff's Department, Tim McKenna at Chardon. All those individuals have had a part of this, and I think it is a mutual issue that we all need to work on. Just a couple other odds and ends I'd like to finish up on, because you guys did such a great job. My hour is now down. How many people are missing the Browns game tonight? I'm just really impressed that we have so many people. Yeah, I almost wore my brown shirt just because, it's like, I had tickets, buddy. Just a couple other really quick things. Appreciate all the time. I think that one of the things that you've heard from the judges in particular is the need for assessment, the need for ongoing treatment, the need for screening. All those things have been problematic for several years now since the cuts in treatment have taken place. And so those would absolutely help in making that process better, faster, more efficient. But it has to be the right people. They have to be certified, they have to be licensed, they have to establish best practice in the state of Ohio as well as here in Geauga County. We only deserve the best, and that is the best way to get treatment and recovery for these individuals. The other thing to remember is, as these people go through recovery and go through whether it's the court system or treatment system, the reality is, whether we like it or not, this is a disease. And it is a disease that comes back over and over and over again because it does change the chemistry of the brain. And there's scientific evidence to show that. And so, as many of you have in your families, individuals that struggle with diabetes or heart disease or lung issues or COPH or some of the other chronic diseases that we have, this is one of those things that keeps coming back, and we will need to continue to provide the treatment services that we've had for so long. Thanks for your time. Thank you for your presentation, because, like I said, you just made the evening shorter for everybody. I appreciate it. I'll send you the statistics that we have for you, and thanks for making this a public time for people to talk about this issue.
Thank you.